Well, I guess it depends where you are in the world. If you're in a system such as the United Kingdom, there is much greater integration. We see palliative management incorporated into the NICE guidelines, which is the National Institute of Clinical Excellence guidelines to managing Parkinson's disease. It's much more fragmented in many other countries in the world. In Canada, there's a beautifully integrated model, which one of my co-members of the task force, Janice Miyazaki, has really pioneered. But we see greater fragmentation in the United States, and certainly in Australia, where I live, is we see significant barriers and fragmentation. And I guess we have to remember that culturally, palliative care has evolved to be a service that supports people living with a malignancy. And for many palliative care services, it's relatively new areas that they're going into when they're starting to look at people with non-malignancy, and in particular looking at neurological illness as being a cohort that they're going to support. So there are a few barriers on both sides. Systematic barriers are something that the Attitudes to Palliative Care article will be a useful vehicle for neurology professionals to actually take to their government and sort of say, we need to break down some of these barriers, as well as sort of those barriers amongst education and learning more about palliative care, which hopefully the MDS can sort.